Welcome to Sononerds Doodle Tutor series. This video will walk you through the basic ultrasound protocol of the gallbladder and biliary tree. We will take a look at ultrasound images, draw diagrams together, label them, and cover some tips to help with imaging the gallbladder by ultrasound. Ultrasound is a fantastic tool to visualize the gallbladder and the biliary tree. We use ultrasound to evaluate the internal contents of the gallbladder and measure biliary components such as the gallbladder wall, common hepatic duct, and the common bile duct. The gallbladder wall should be less than 3 millimeters in thickness. The common hepatic duct is typically normal when less than 4 to 5 millimeters, and the common bile duct is normal when less than 6 millimeters. However, it can measure up to 10 millimeters before being diagnostically relevant. To fully evaluate the gallbladder, we start scanning the patient in the supine position, which means to have them on their back. We should also roll our patients into the left decubitus position, which means to put them onto their left side. The gallbladder is a very floppy organ and will have variable appearances in the two positions. The most common pathologies of the gallbladder are sludge and stones. Rolling the patient helps to lengthen the gallbladder and determine mobility of internal contents. Before taking pictures of the gallbladder, make sure to sweep through the longitudinal plane. The transducer position will be dependent on the patient's anatomy. Find the longest view of the gallbladder and sweep side to side, looking at the walls and the inside of the lumen. From where you found the longest plane of the gallbladder, turn the transducer 90 degrees. This should be your transverse view. Sweep all the way out of the fundus, which usually means sweeping towards the feet, and then come back up through the neck. Next, we will take a look at the individual images of a standard protocol. You will want to use these images at a minimum. As a sonographer, you may choose to add more pictures in when necessary, or may be required to do so by your place of employment. However, wherever you go, these protocol images will serve as a good starting point. If you are drawing along, make sure that you have your paper and pen now. If you want to print out pre-made sectors, check out the link in the description box. After each image is completed, you'll want to pause to complete your drawing before moving to the next image. The gallbladder parts include the rounded fundus, the body, and the neck. Your longitudinal image of the gallbladder should attempt to connect all three components. There are multiple windows to the gallbladder. Be sure to view the gallbladder through all of them and then choose the best one that visualizes the entire gallbladder. You may need to take more than one picture if all three parts of the gallbladder cannot be seen in one image. Have your patient take a deep breath in and hold if necessary. The gallbladder will appear as a pear-shaped organ. Use your gain and TGCs to make sure that your gallbladder is cleared of artifact. Do not overly correct though. You should still be able to see the low-level gray of the surrounding liver. The major landmarks you will see in this image include the gallbladder, the portal vein, and the main lobar fissure. You will also be able to see the liver surrounding the anterior side. You will see the duodenum on the posterior side of the gallbladder. The hepatic artery may also be visible in this image as well, as it is part of the portal triad. If you choose to measure the wall in this image, find a representative portion on the anterior wall next to the liver. Turn your transducer 90 degrees and you should see the transverse view of the gallbladder. Make sure that you move towards the feet to see the fundus and towards the patient's head to get to the neck. These are common places for pathology to hide out. Find the widest portion of the gallbladder where it is nice and round. This is going to be typically at the body. In very thin patients, the IVC can sometimes be mistaken for the gallbladder, so you may want to use color to ensure that you are imaging the correct anatomy. Best practice when imaging the gallbladder is to zoom and sector in on it. Remember that these are gallbladder images. We've already imaged the liver and we will image the right kidney, so they are not the focus of our picture. Really show the gallbladder in your images. When the patient is supine, the fundus of the gallbladder hangs down towards the feet. You may be able to see the kidney in this image because of its position. Make sure to clear out artifact of the gallbladder. This image is often used to measure the gallbladder wall. You'll want to choose an anterior portion of the wall where the liver and gallbladder are adjacent for the best measurement. Never measure the posterior wall of your gallbladder. Roll your patient onto their left side. Make sure that they are all the way up onto the left side and not kind of angled back towards you. Label this image as decube or LLD for left lateral decubitus. Watch for small mobile debris or movement of pathology after rolling. The gallbladder shifts into more of a midline position with the fundus now more medially or hanging towards the patient's left side. After you roll your patient, it actually might be kind of tricky to find where that gallbladder went. Make sure to watch your transducer, move it to the patient's midline, and begin looking for the gallbladder in the more medial position. The liver will still be anterior to the gallbladder with the duodenum posterior. Find a window that connects all three parts of the gallbladder together in its longest plane. Use your TGCs and gain to clear out the gallbladder of artifact. You can measure the wall in this image. The last image of the gallbladder is in transverse while the patient is still LLD. Look for the widest portion and save an image. In this example image, the stomach can be seen to the left of the gallbladder. This is your last chance to measure the gallbladder wall as well. Turning the transducer 90 degrees from the longitudinal image will help to get you into the correct position for the transverse plane. This can kind of be a tricky image to clear of artifact because the gallbladder is usually surrounded by more bowel and the stomach. To measure, find an area on the anterior wall that is adjacent to the liver. The liver offers an excellent acoustic window to see the detail of the gallbladder wall. After imaging the gallbladder, the next step will be to look at the biliary tree. Ultrasound can be used to see the common hepatic duct and the common bile duct. These structures are continuous with one another, but are differentiated by the porta hepatis. The common hepatic duct should be surrounded by liver and anterior to the portal vein. The common bile duct is outside of the liver and is also anterior to the portal vein. The common bile duct can be seen running all the way to the pancreas head. To identify the porta hepatis, look for the edge of the liver. The portal vein, hepatic artery, and bile ducts enter and exit through the porta hepatis. Identifying these structures and the edge of the liver will give you a visual cue where the common hepatic duct and common bile duct are. Use color Doppler to identify the ducts. They should not exhibit any color. Leave color on when you take these pictures and measurements. This will help the person reading your images to also identify the ducts. It can actually be really difficult to get both the common hepatic duct and the common bile duct all in one image. You should not strive to get them in one, but rather take two separate images of the structures to show these structures completely. Zoom into the porta hepatis and use your color to prove that the structure is a duct versus a vessel. Remember now that the goal is to visualize the common hepatic duct to the best ability, so make sure that you are zoomed in, making the common hepatic duct the focus of your image. You will see liver surrounding the common hepatic duct, showing that you are inside of the liver and truly measuring the common hepatic duct. Use your color box to differentiate between vessels and the ducts. The common hepatic artery can sometimes mimic the appearance of the ducts. In your image, you should be able to see both the common hepatic duct, liver, and portal vein posterior to the common hepatic duct. The gallbladder may also be visible in this picture as it is very close in proximity to the porta hepatis, and in this image, the IVC is running posterior. You can take the duct images with your patient either in the supine or rolled position. The rolled position may actually provide a better window to the common bile duct as the duodenum will change positions. Another way to identify the common bile duct is to visualize the pancreas head. Looking for the two circles at the head, remember that the more anterior one is the gastroduodenal artery and the more posterior one should be where the common bile duct pierces the pancreas head. This will help to ensure that you are outside of the liver. Another thing that you can look for is to make sure that you do not have liver on both sides of your common bile duct. It is quite often on the anterior side, but not on the posterior side. As you move out of the liver, remember that you are looking for the common bile duct. So you can zoom in on the porta hepatis. You want to work to elongate the common bile duct. We've already imaged the common hepatic duct, and we don't need to elongate any other vessels. We are focused on the common bile duct. We should see it anterior to the portal vein. To elongate the duct, the transducer is often in more of an oblique position, with the notch in more of a 10 to 11 o'clock position. Try having your patient take a deep breath in to steady the area. Zooming in on this area will also help to better visualize and measure these small structures. Turn the color on for your image and take an image with and without measurements. Make sure that when you do take measurements, you are measuring from inner to inner wall. Thank you so much for watching Sononerds Doodle Tutor on the biliary protocol. Be sure to check back for more drawings and other educational content.